the first startup taught me what we can do with data, how powerful that data is. And the second one taught me what happens if we don't use it. The people who come up with the wonderful ideas aren't always best suited to bring them into the world. All right. So my name is Cassie Allen. I am the Chief Revenue Officer for mPATH Health. I'm going to tell you a little bit about sort of my journey and my experience in commercializing startups. So to get started, some background. I am, as I mentioned, the Chief Revenue Officer here at mPATH. mPATH is a digital health platform that doubles cancer screening. It's the fourth biotech startup that I've helped commercialize. And my prior experience is in predictive analytics in healthcare, specifically around quality metrics, also molecular diagnostics for oncology, and prior to that, international biotech distribution partnerships. So, when I was speaking with Igor over the course of the week at Seed the South, we were talking about um, various things, but as a prompt for this conversation, he suggested sort of lessons learned from commercialization. And as I was considering those and thinking about how to distill them down, there's one sort of theme that kept coming up. And this is something I see consistently in leaders that inspire me and leaders that get things done. And it's people who are acquiring competencies. So the competencies that you build, the skills that you pick up, are what's going to help to propel you forward. So in this business, in entrepreneurship, there's no job beneath you, and you need to know about a lot of things. So that's been a really important part of growth. So accumulating competencies, you always want to be a novice at something, always be learning. And leaning into the things that challenge you the most. So if you struggle with public speaking, the only way through that is to provide yourself with evidence that you are capable of doing it and competent in that area. And that is how you gain the competency. So the next step, once you've identified the way forward, which is to increase your skills, improve your skill set, then you have to determine which competencies you need in order to be successful for your particular business. And that's a process in and of itself. It starts with self-awareness. So learning how, being aware of what you don't know, for instance, is one part of that puzzle. And once you're aware of what you don't know, being curious about what you don't know. The methods to acquire that information, in my experience, have been collaboration. So it's walking over to the person whose job function isn't in your vertical, but affects yours, and learning from them about their job. And that gives you the skills that you need to apply to the next challenge. And also mentorship is a really good way to increase the skills that you need to be successful. All right. Startup leadership demands a diverse set of skills, and we never have enough resources. So we're in startups, we are constantly doing more with less. And that doesn't stop. When we're not doing well, we're tight on budget for a lack of revenue. And when we are doing well, we're tight on resources for reasons of scale. So that never stops. And that's something you have to build a really strong tolerance to. And the only way through it is to either recruit the expertise you need or develop those competencies yourself. The best leaders in startups that I've encountered are not the best in the world at any particular thing. They're really good at a handful of things, but they're proficient in a surprising volume of areas. And I think that's what really makes the difference. So what competencies do you need to build? Obviously, you want to target your skill development toward your mission. And you can't do that if you don't know what that is. So that's another key component to successful leadership in a startup. You have to know why you're doing this. It helps you to determine what's most important to learn. It also helps guide your decision making and resource allocation. As I mentioned, the dynamic of consistent resource constraints in startups makes every resource allocation so critical. So making sure that you and everyone you work with is very, very clear on what you're there to do makes that a lot easier. And it helps everyone get aligned and keeps you motivated on those super duper late nights when you're pulling an all nighter trying to get something done. So that's all I have to present as far as just straight content, but I'm interested to hear what questions you guys have. This is the fun part for me.
Before advisors jump in, I wanted to kind of have you reflect a little bit on your journey, because you worked at startups at a different level. So right now
Yeah.
it's a little bit less mature startup. You had more mature startups before.
Yeah.
What kind of personal lessons from your journey, one or two, could you share as it relates to those roles that you held?
Yeah, the most valuable experiences I've had were the ones I volunteered for that I'd never done before. And I think that's where a lot of people struggle, is the hesitation. I mean, by definition, working in a startup means you're doing something that hasn't been done before. So keeping your resistance low to trying new things, being able to say, so if I don't understand contracts, for instance, that was something I struggled with at an earlier stage in my career, and the contracts were getting increasingly complex, and the financial instruments being described were increasingly complicated, and I needed that skill to be fluent, not to be the expert in that, but to be able to keep up. And so just taking it upon yourself to not skip those finance meetings because it's not an area that you're expert in, but to really lean into it, to go and have lunch with that person and have them talk you through it, and get that proficiency, not because you want to be the CFO necessarily, but because it helps you anticipate better. So I had some excellent mentors, some really, really talented people who were very, very generous with their time, but they wouldn't have given it to me if I didn't ask for it. So that, I think, is a really key thing.
Thank you. Guys, any questions? Cassie.
I might have one for Cassie and the group. This is Doug. Cassie, in the healthcare, I was going back to your last thing you talked about, the mission. Just kind of keep it focused on mission. I found sometimes it can be tricky especially when you're dealing with clinicians. Right, it's all about the patient, and it is about the patient, improving patient healthcare and everything. But sometimes it's really about keeping the company afloat.
Yeah, well,
And
that's where it comes down, I think, to that proficiency thing. So knowing what they care about. So one trick, I've had a similar situation very often where healthcare is so slow moving, it's very hard to get that commitment and to get things moving forward. Is that sort of the kind of dynamic you're referencing there?
yeah, or just being too focused on we got to make this perfect. We got to make this product perfect. It's got to work
Oh, yeah.
just the way
No.
versus no, we got to make some sales.
Yeah.
So we have a product a year from now or 2 years from now.
Yeah. Yeah, it is challenging. And then, of course, the sales cycle for healthcare is also a challenge. So that adds a degree of complexity. But that's where it comes in. I mean, in startups, we're always wish we had 10 more salespeople to get that revenue up so we can spend on development. But it is sort of a chicken and egg. You need the revenue to do the dev, and you need people to do revenue generation. So that's why people like us end up doing all the things until we have the resourcing available to have more help. And that's where those little experiences all along the way, where you ask the question, or, you were in project management, but you signed up to do a pitch, or you traveled with the project team that's not in your wheelhouse and you learned something. Every single time I've done something like that, it served me well going forward. But you do have to balance them. You've got to deliver on your results while building for your growth. And it's always a balancing act. That really is the hardest part.
By the way, I've met your partner there, Dr. Miller.
He's so
He's
wonderful.
a good one. He gets the clinical and the business, I think.
He does, and that's a unique skill. And my co-founder is a tech head. I mean, he was an engineer before and worked in the patent office before becoming a clinician. So I'm really lucky there. It's just important, I think, to understand the people around you, what you can learn from them. It's our instinct very often to go in a room not wanting to admit what we don't know, wanting to be protective of that. And the best thing to do is to really just be seeing that as an opportunity. And people love to talk about their expertise. People are going to enjoy having that conversation with you if you ask, obviously in the right setting. And wouldn't it be nice if we could just pick the brains of all of our prospects and in that way? But yeah, it is challenging for sure.
By the way, Cassie, I was teasing because we were talking earlier before you got on the call. And Margaret was saying she had some poor experiences with co-founders.
Yeah. Yeah. I mean, the people who come up with the wonderful ideas aren't always best suited to bring them into the world, right? That's why they need people like us who can be fluent in the science, but also can navigate the ins and outs of the business process and sales cycles and all the finance bits and all the operational bits and putting all the infrastructure to make there be a company underneath this idea. That's not usually what they're great at. So find people who can or learn. It's the only way to survive.
But how do you balance that with a founder who does think he can do all that, where he does have his or her own opinion of how they should commercialize the business, or is critical that their phone isn't ringing off the hook since they just built the greatest thing ever?
Yeah. So sometimes you got to let people experience it for themselves. Like bring them along with you and educate them on the process. Oftentimes that's just ignorance. They just don't understand. And so like a real sit down, but some people, it's just a personality problem. They're not going to get it. Like, and there's only so much you can do in that situation. But very often founders are so convinced of their value proposition because they built it for a reason. They were solving a really big problem, and it's hard to understand why the traction isn't as rapid as they would think. So you've got to set expectations like early on and be really clear with the roadmap. So in order to get where you want to be, here are the things that would have to be done, and here's about sort of mapping out the timeline for that. That helped, but you gotta bring them around to a realistic go-to-market plan. And that's tough.
Before they run out of money.
Yes. Yeah. That's the hard bit. Yeah. But I mean, and it really comes back, I think, to purpose. If you're really clear on what that is. So for us, it's getting people screened for cancer. And the reason that's so very important is a little bit of learning along my journey, right? So 2 startups ago was a predictive analytic company, and we could comb the claims data and other data sources and find patients who were out of compliance with value-based care outcomes metrics, your CMS stars ratings stuff, and sort of population level advise on who could be moved and what interventions to use to get them going. But what do you do with that when you have it, right? With privacy laws the way they are, it's not like you can call clinicians when you find something and say, hey, did you know your patient is at risk for such and such based on data? So we could send them to care navigators within the system that was, hiring us for the service, but getting them to actually do anything about it, like the execution of that was challenging. But it was very motivating to companies who have a vested interest in reducing costs and meeting those value-based care targets. So then I moved over to a molecular diagnostics company, and we were finding cancer and finding what alterations were present in a patient's tumor. This is for lung and colon cancer. And then we could tell what targeted treatments would be appropriate based on that. So it's liquid biopsy. And then we would do minimal disease surveillance and recurrence detection stuff by finding cell-free tumor DNA in the plasma. But with lung cancer patients, we don't find them 70% of them until stage 3 or 4. So by then, your survival probability is awfully low, no matter what we do. And that is infuriating. So the first startup taught me what we can do with data, how powerful that data is. And the second one taught me what happens if we don't use it in time. So that made the mission really, really clear. And if you keep those conversations happening that are mission centric in those meetings, it helps It helps make the other stuff that's distraction fall away. So I try to keep that very present. Like, what are we doing that's advocacy? What are we doing that's mission focused, to keep that energy up? And keep people from getting too far in the weeds on friction that holds us back.
Thanks.
I have a question about opening doors as a startup, because you obviously had some good partnerships already. Like, how does it work? How do you open the door to a new organization? What's the trick?
Yeah, so they come in a variety of ways. I mean, a lot. So some of it is personal network. Some of it is people that you meet at events. Um, some of it you go seek and find with a partner. I mean, it is hard to find good collaborators with, it's often organic. There are lots of channels to do it, and it depends really on where you're looking. But if you're trying to open the door for prospects, it's like customer acquisition. You have to have some amount. So what a lot of startups do wrong, and what I've seen done wrong. So a couple ago, what happened was C-level leadership wanted to hire some sales folks. So they just did. No operational, no sales operations existed. We didn't, you didn't have a CRM. You didn't have anybody to manage those people. They're just like, we have a really good thing. Let's get some people to go sell it. That won't work. So then they brought me in to help make there be organizational structure, and then you can do that. So I don't skip the steps, the thoughtful steps. They don't take very long to get a little bit of thoughtfulness and organization under your go-to-market plan. But if you don't do it and you think you can just sick some salespeople out there just to talk everybody's head off about your value prop, it won't work. You have to have consideration about how your clients purchase. Do they even see salespeople? Sometimes they won't. You have to go through an RFP type of process, and then that's a whole different ballgame. So I think that's an important thing: a very well thought out and thorough go-to-market strategy.
Cassie, when you approach a healthcare system, what's the biggest pushback that you normally get?
The biggest pushback I normally get is, well, there are two, and they're connected. They're time and compliance related complexity, right? So either I have no available minutes to even entertain a conversation about anything, right? That's a legitimate answer. And then the other part is the level of effort to do any technical implementation whatsoever that involves health information is a non-starter, because it's going to cost me too much time. So that's why you have to sort of lead with that in your initial conversation. So we have to make it very clear for us that we run entirely external to your EHR, and you have to know your patient's pain points and what makes them nervous to be able to be proactive about that. But you market yourself as an external to the EHR solution, because you know that's a huge problem for them, or whatever your particular situation is. But yeah, that's what I hear. It's time and technical level of effort. But yeah, that's easily overcome if you remove barriers, and if you have a really strong advocate internally.
Cassie, thank you so much for joining us today.
Yeah, happy to do it.